Hello and welcome. Today I am going to talk to you about OSCE. In OSCE, there is a scenario that has come up as a new scenario that is called pediatric inhalation. So many students were asking me how they are going to go for the pediatric inhalation and what are the things that you have to take into consideration while you are going for the pediatric inhalation. Okay. So today I am going to talk to you about the pediatric inhalation as far as the OSCE scenario is concerned. I'm not going to talk to you much about the theory aspect, but how they are going to do it in the OSCE and the expectation from the examiner, what they are going to expect. Okay. So there is a pediatric inhalation. That is what is you are going to do that. It's a prescription station. So in case of prescription or a cardiac station, what are the things you have to take into consideration? So you have to go for cardiac checking, and the second time you have to check for with the patient ID with the cardiacs. You have to explain the medicine with the cardiac with medicine to the patient, and you have to explain the side effect to the patient. So these all things you have to do, and also you have to sign in the cardiacs. And it's quite unclear whether this is going for uh, a second check, but it looks like, I presume it looks like this is a second checker is needed because it's a pediatric medicine. Okay, now I'm going to talk to you about the pediatric inhalation. So how you are going to manage pediatric inhalation is basically I have a mannequin over here, and I have two pediatric inhaled medicines are here, something like this one, and there is a mask is here, and there is a spacer is here. Okay, so this is the spacer, and one part. This is the part that is going to the to the mouthpiece over here, and this is the part that's going where you are going to attach the canister over there. And this is the inhalation. Okay, I have a model inhalation here. So this is the inhalation in which it is called a blue inhalation. Blue inhalation is basically a bronchodilator, and the other one is a red inhalation where it's called this is the red inhalation, where it's not red, it's a brown inhalation where it's going to be a steroids over there. Okay, so in both scenarios what is going to happen is in bronchodilator you have to talk to the patient. There is no specific instruction, but in case of this one, you have to go for a health education in which you have to go for a mouthwash straight after the procedure. So straight after the procedure, you have to go for a mouthwash means there is a high chance of the child is going to get thrash in the mouth. So that examiner is going to look for that. So that's your job. Okay. Now I have a mannequin over here. It's a baby mannequin. In fact, you will be getting a child, either a child mannequin or a baby mannequin. You are going to get. So how you are going to approach for the patient? So initially the typical approach is everything I am not going to discuss, but how you are going to administer. Okay, so you take just in case of an asthma inhaler. So you take the asthma inhaler, and this is the spacer, and this is the mouthpiece. So what you have to do is you have to wash your hand either, but I would suggest to go for a hand gel application rather than washing the hand because you don't have much time in the OSCE. And this is the spacer contains two portions. Okay, this is the connecting portion. I'm not going to look into that. So this portion is this is the place where you are going to attach the mouthpiece. So this is the way you are going to attach, and that the mouthpiece is having two parts. That this is the conical portion, and this is the flat portion over here. Conical portion will be going over the nose bridge, and the flat portion is going over the lower part of the jaw. That's on top of the jaw. Okay. So what is going to happen is, if I took into consideration this scenario, see, look over here, this is the way you are going to attach the mask over here and the spacer over here. Okay, so initially you have to explain the mask as well as the spacer to the patient as well as the parents. You will be getting parents over there. So parents, you have to explain to them how you are going to do the procedure. Okay. Then what you have to do is, so example, this is a scenario in which I am going to leave the patient like this. You have to high up the patient. That's very important. Once the patient has a high up, then the other job is ask the patient whether he had any bronchodilators straight now or something. That you can ask the patient. There is no problem on that. And then next one is the inhaled medicine. So this is called a canister, and this is the spacer, and this is the mouthpiece. So you have to take out the inhaled medicine, the mouthpiece over here, and you have to shake the canister 3 to 5 seconds. You have to count 1, 2, 3, 4, 5. Okay, so that's why you have to count, and then you have to teach the patient what you have to do. So ask the patient to take a slow breath, okay, in 2 to 3 seconds, and hold it for 10 seconds. If the patient, baby or the child says, I can't do it, then you have to go for a tidal breathing. So that's the way it's going to work out. Okay, now, so I'm going to leave it over here. Okay, so for example, the patient's name is John. John, I have the inhaled medicine for you. Can I proceed? Is that okay with you? So what you have to do is, I'm going to, this is the mouthpiece and this is the spacer over here, and this is the canister. When I'm going to attach the canister over here, I'm going to press down. Okay, so you have to take a slow breath of 2 to 3 seconds. I will count and hold it for 10 seconds, and then you breathe out slowly. Is that okay with you? And that if the patient is going for a second puff, you have to have at least 20 seconds of time duration. Okay, and if the patient is going for a second medicine, so for example, he is going for another steroids or another medicine, you have to go for at least 2 minutes time duration in between. So this is the points you have to keep in consideration now. So what you are going to do is, I'm going to attach the canister over here. Ask the patient. Okay, I'm going to shake the canister like this way. Okay, I'm going to attach. I'm going to place it over here. Okay, now I have to talk to the patient. Okay, I'm going to press down. Take a deep breath. 1, 2, 3. Okay, and hold it for 10 seconds. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now you can breathe out. Okay, good boy. You are doing it. That's great. Now 20 seconds over. Can I do it for a second time? Okay, take a slow breath like this way. Okay, I'm going to attach. Okay, and I'm going to press down. Okay, and repeat the same procedure. Once the patient has done it, then next job is you have to clean the, just verbalize, you are going to clean the spacer as well as the mouthpiece, and also you have to close this one of this one, and leave it over here, and you have to sign and make the patient comfortable. So this is the way you are going to do for the pediatric inhalation in case of osteal scenario. If you are looking for any support for osteal noski, come back to me. I'm doing osteal noski 100% success for last 4 years, since the beginning of osteal noski. So if you are looking for any online support or offline support, come back to me. So, and also if you need any questions or clarifications, or are you looking for any further points to be discussed in the video or something, just give me a comment on that side. Okay, so thank you very much for listening to me, and I'll come back with another wonderful video next time. So thank you.